Okay, so we're back with Deb, and we're just going to help her with a couple of corrections here, neurologic corrections, some physiokinetic stuff we're doing. And I'm going to shake hands with her. She's going to hold her arm out and brace it to her side. And we're trying to correct this foot over here. So that foot wants to turn out. That's the pattern in the foot. And when they need to get balance on the other leg, they've been favoring a leg. You want to push them away from that side. So she's pushing away from that side, then have them lean into it with their chest up. And that fires all these core muscles that we're talking about from the pelvic floor up. Doesn't that feel good there? Good. So I want her to balance over that leg as she pushes. And what that's going to do is going to work the cross core. It's going to work the internal rotation. You feel that in your groin?
Yeah.
Yeah, she's starting to feel it in her groin. It's strengthening that. Push
Back.
low back on the left.
Yeah.
And relax. And so she's loading that side. When she's loading that side, she's getting some contraction over here on the left to stabilize. So QL. Her center of gravity should be better, which it is now. Come here, let's walk over here. And that'll change her center of gravity over both legs. Now she's still going to have some, structure doesn't make you, just because structure is not perfect doesn't matter sometimes. It's about function. It's about the function. Does she feel better?
Yeah.
And that makes her more stable. So remember that we can't get locked into this whole structure stuff. And things are not level inside of us. Don't expect them to be level all the time on the outside. But as we get going, the function is what matters. So I hope you learned something from that. Thanks, Deb, for helping us out.